Hi, my name's Danielle and I'm a nursing student at Marian University, and today I'm going to be administering some medications to a patient. We have 2 oral medications that we're going to be administering, as well as setting up an antibiotic piggyback for an IV, and then we also have 2 injections. So to start out, I'm going to go ahead and I would check my orders, and I would see that I had some medications ordered. I would check first to make sure that there aren't any allergies or interactions between the medications before I administer anything. And then I would go ahead to the Pyxis and I would gather all my supplies. So today we'll pretend that this is the Pyxis, and I see that I have my antibiotic, which is gonna come and be my piggyback for my IV. And then I have, which is Kefzol. And then I have my normal saline for dehydration. And then I've got my supplies for my IV set up. And then I also have my B12 for anemia that we're administering to the patient, and a heparin injection that's an anticoagulant that we're going to be administering for the patient while they're in the hospital. And then for oral meds, I have atenolol for hypertension, and then also acetaminophen or Tylenol for a fever. So once I gather all my supplies from the Pyxis and I verify that none of them are expired, the expiration dates are good, that the milligrams and the dosage is correct for what was ordered, then I'm gonna go ahead and go to the room and go through my CG wiper and get started. So I'm gonna go ahead and I've already checked my orders, I've gotten all my supplies, I'm gonna go ahead and wash my hands again, and then I would go ahead and enter the room. Hi, my name's Danielle. I'm going to be your nurse today. Can you verify your name and date of birth for me?
Danielle McCain,
Okay, and your date of birth?
12/26/1986.
Okay, perfect. So I did verify with the 2 identification markers that this is in fact the patient that I am going to be administering meds for. The next thing I'm going to do is provide privacy, so I would shut the door or pull the curtain, and then I'm going to go ahead and explain what we're doing today. So today it's 9 o'clock and I have a couple of medications that we need to administer. To start off, I'm going to go ahead and set up, we have an antibiotic that we're going to administer through your IV for you. Since you already have that line in, I'm going to go ahead and get that all set up first. And then after that, I have 2 injections as well as 2 oral medications. Do you want to do the oral ones or the injection first?
Injections.
Injections, okay. So now at this point, I'm gonna go ahead and get ready to set up my IV. So I would normally raise my bed if I needed to. And then for the IV, I'm gonna go ahead and open all my supplies, and I'm actually just gonna pull the trash over here. So this first one is going to be Kefzol, which is an antibiotic for your pneumonia and for the infection. So this is going to be the secondary. So what I'm going to do is go ahead and open up my secondary tubing so that I can go ahead and get everything hooked up when I need to. And then I also have some normal saline here. And this is going to be just to make sure that you're nice and hydrated while you're here in the hospital, okay? So I'm gonna go ahead and hang the primary first with this hook, just to make sure that it hangs lower than the secondary. And then my secondary, I'm gonna go ahead and hang just above that. So for my primary tubing, when I open it up, I like to go ahead, and the first thing I like to do is make sure that I close my clamp so that it doesn't go all over the floor. And I also like to pull my clamp all the way down to the bottom, because it makes it a little bit easier to control when it comes time to prime the line. So I'm gonna roll that down and clamp it. All right, and then I'm gonna go ahead and spike the bag. I'm gonna go ahead and pull off this top part here. And what I'll do is when I pull this off, this is sharp. I wanna make sure that I don't touch this sharp end when I'm spiking the bag, so that way I don't contaminate it. So I'll go ahead and I'm gonna pull that off, toss the cap, and then I'm gonna pull off this blue part. I'm just gonna twist it in, and these are a little bit tougher to get in than normal. Okay, and then once it's in, I'm gonna go ahead and I'm gonna squeeze here a little bit, and then I am going to go ahead and prime the line and make sure I get all the air out of my tubing. Just about through, and then you want to make sure that you're not losing any out of the end if you can. So now that that is ready to go, I went ahead and I replugged it, and I'm going to stick it up here till I'm ready for it for the next part. And then we're going to go ahead and we're going to spike the secondary line. So same thing, when I take my cord out, I'm going to go ahead and, like I said, I like to pull it down towards the end so I have a little bit more control. And I'm going to clamp it so that I don't lose any of the antibiotic. It's really important when you are administering the antibiotic and you're priming the line that you don't lose any of it. So make sure that I have that under control. Then I'm going to go ahead and pull off my cap again. Okay, while I'm getting this set up, I usually, especially if I'm administering medication, I usually like to ask the patient, you know, if they have any known drug allergies, just to make sure that everything in the chart is correct and accurate. So I would normally ask them if they have any known allergies, just to be careful while I'm getting this together. So now that I have that spiked, I'm gonna go ahead and I'm gonna squeeze it. And I've got bubbles, which means it's good. All right. And now I'm gonna go ahead and prime this line. And like I said, this is the important part to make sure that I don't lose any of the antibiotic. If I did, we normally would have to start over, depending on how much I lost and what the doctor ordered. Okay, so now that everything is all primed, I'm gonna go ahead and put my IV together. So, let me go back up here. Got a lot of cords going on. All right, so I'm going to take my alcohol swab and I'm going to wipe the top of the port. Let that dry real quick. And then I'm gonna go ahead and I'm going to attach that. And then at this point, I would release my clamp for my secondary so that that is all flowing together. And I can go ahead and remove this tubing as well. And then I am ready now, and I would go ahead and I would attach this to the IV in the patient's arm. So my IV would be ready to go, and we'd be good to go there. So now I'm gonna go ahead and finish up administering the rest of my meds. And before I did attach it to the patient's arm, normally you would do an IV flush just to make sure that the line was clean, and also check for any infiltration in the IV in the area before I go ahead and insert the IV or to the connection, so that way it's all good to go. All right, and then you said that you wanted to go ahead and do your injections next, so I'm gonna get those ready for you, okay? First up, we have a vitamin B12 injection. So the B12 injection is for your anemia. There's really not too many side effects of this. You might notice some bruising at the injection site and some soreness at the injection site would be the only thing. And then the other injection is gonna be heparin sodium, which is an anticoagulant. We typically administer that when you're in the hospital just to make sure, especially because you're laying in bed, that you don't get any blood clots. You're gonna wanna be really careful with being on the heparin, that you don't fall or get out of bed on your own. That way we don't have any internal bleeds or bruising, because you can bruise really easily on the blood thinner, okay? So the B12, I'm gonna go ahead and I'm going to administer via an IM injection. So I'm gonna make sure that I have my 2 blunt tip needles for my injections right here. So to start off, I'm gonna check my dosage. And it looks like for the B12, it's gonna be 1,000 micrograms. And so I'm gonna go ahead and look at what I have here for the B12. And it looks like it's 1,000 micrograms per milliliter, so I'm gonna need 1 ml. So I'm gonna go ahead and I'm gonna place my blunt tips, and I would have gloves on during this procedure. So I've switched to my blunt tip needle, and I'm going to take an alcohol wipe. I'm gonna wipe the top of the medication that I'm gonna be pouring from. Once that's dried, I'm gonna pull back 1 ml of air, and then I'm gonna go ahead and I'm going to remove my cap. And I usually place it down like that so it's easily swooped back up when I'm ready to recap. And I am going to go ahead and go straight down into the bottle and inject the air, and then pull back my 1 milliliter of medication. Well, hopefully. And I want to be careful to make sure that I don't have air. So I've got a little air bubble in there, so I'm just kind of flick it a little bit. All right. And then I would go ahead and pull out. And then what I'm gonna do is go ahead and recap the blunt tip needle. And I'm gonna go ahead and remove the blunt tip needle. And I'd throw that in the sharps container typically. And then this is my IM needle, so I'm gonna go ahead and attach that. Verify that I have the correct dosage, and I do, and all air bubbles are up. Now I'm gonna go ahead and we're gonna use this fat pad to pretend that this is the patient's body part that I'm gonna be administering the med to. For the intramuscular injection, we're gonna be administering it right into the deltoid muscle. And so what I would do is go ahead and I'm going to clean the area with an alcohol swab. And then you're gonna wanna wait for that to dry, and you still have gloves on at this point. And while I'm waiting for that to dry, I typically would get my cap loose for the needle. That way it's ready to pull out when I'm ready to go. And then once it's dry, I'm gonna go ahead and I am going to use the Z method to pull the skin tight. So we go like this, and then I pull my needle out, and we're gonna go in at a 90-degree angle. So I'm just gonna go straight in, and then you're gonna inject the med. Okay, and then you're going to go ahead and pull out, and you wanna make sure that you recap right away and dispose of your needle. So I went ahead, at this point, I would place a 2x2 and a Band-Aid, and the patient would be good to go for the B12. Next, I'm gonna go ahead and get ready, and we will administer the heparin. This is gonna be our sub-Q injection. It looks like the doctor ordered 1,500 units. So it looks like heparin comes in 1,000 units per milliliter, so I'm gonna have 1.5 milliliters. Again, I would have my blunt tip needle first, and I'm gonna pull back for 1.5 mLs, and I would wipe the top of my vial. Okay, and once that's dry and ready to go, I'm gonna go ahead and I'll remove my cap for my blunt tip. I'm gonna go directly in, insert the air, and then I'm gonna pull back the 1.5 milliliters. Maybe this doesn't have quite as much liquid left in it, so I'm having to go a little further down to get everything out that I need. And again, I have a little bit of an air bubble, so I just pulled a little bit over 1.5 mils just to make sure that I have what I need. I pull directly out, immediately recap, and then I'm gonna remove my blunt tip. Make sure I have all the air bubbles out of the way. There's just one in there that does not want to go away. Okay. And then I'm gonna go ahead and I'm gonna place my sub-Q needle on. Now for the sub-Q injection, I'm gonna go ahead and administer 1 to 2 inches from the belly button. If the patient has enough of a fat pad, we can go right in at a 90-degree angle. If not, if it's a thin patient or a child or maybe an elderly patient who doesn't have as much fat on their body, we would do a 45-degree. So I go ahead and I check everything. I'm gonna prep the area again with an alcohol wipe. Okay. And then I'm gonna go ahead and while that dries, get my needle ready. And then we'll say it's dry, and you're going to go ahead and pinch. This fat pad is squeezing out fluid. We're gonna go ahead and pinch, and we're gonna go directly in and then inject. Okay. And then you're gonna pull back out. You're going to recap. And then discard of your needles and your supplies. And if you need to, you can place a bandage. Usually with the sub-Q, they don't always need one, but we could go ahead and place a bandage if needed, or some gauze. Okay, so at this point we have administered the heparin, we went over the safety procedures, and then we have 2 more oral medications to administer. So we have the atenolol, which is for your hypertension. We did check the patient's blood pressure at 8:30 this morning. And it looks like it was 142/84, so it's a little bit high, which is to be expected because it's time for that next dose of your medication. With the atenolol, a couple things to note. It can make you dizzy, so you want to make sure that you change position slowly. The other thing is that it can cause some constipation. So if you do have any type of upset stomach, please let me know. And then the other med I'm going to go ahead and give you is going to be Tylenol or acetaminophen. That is for your fever. It looks like when we took your temperature, it was 101.5, so it's over 101, and the doctor wanted us to try to keep that down. So we're gonna go ahead and give you some Tylenol just to make sure that we can keep that under control while you're recovering. So I would go ahead and I've got my meds already, check again the dosage, and I would open them up and I'm gonna drop them directly into the little cup. I would have gloves on, but you wanna make sure you don't touch the med. And then go ahead and I'm gonna bring the patient some water. Alrighty, and then you can go ahead and take these from me. And then one of the things I didn't mention earlier is with that antibiotic I started, you can have some nausea, vomiting, upset stomach. So if you start to not feel great, let me know. That way we can go ahead and get you some medicine or get you taken care of so you're feeling better, okay? Other than that, I think I went over all the other meds that I gave you. So at this point, I'm gonna go ahead and I'm gonna clean up my area and I'm gonna reset the bed to the correct height, make sure the patient has access to the nurse call light, ask her if she has any questions, and then Lorna, I'll probably be back in about 30 minutes to check on you and make sure you're doing okay? And then at that point, I would leave the room and I would document everything. So, thank you.